out down here what they mean by those things. For that same 99214, if we follow our green line over to exam, it tells you for a detail, the 99214, you have to do at least 2 body systems or areas, and you need at least 12 bullet points. And then, even if you don't pull up the full guideline list, although I think you should look at it at some point, they give you the rundown of the bullets. So if we look at eyes, a bullet point, so 1 point for inspection of the conjunctiva and lids, a point for the examination of pupils and irises, and then a point for your fundoscopic exam. So that would be 3 bullets. You add in a few more bullets from ear, nose, and throat. You check their thyroid and check for midline and trachea, and everything is symmetrical, and you can very quickly get to 12 bullet points. If you want a comprehensive, if you want that 99215 or the 205 or 204, you have to then do 9 systems with at least 18 bullets. So that's where you get to your general multi-system exam, where you have to do something out of all of these, and it continues on to page 2 for the other pieces of your physical exam. If we follow the blue line around for our medical decision making, this is why this is a cheat sheet. They don't talk about all of the data and diagnosis and management options or what makes up the points for the data score, but that is over on the audit tool, so you can become familiar with it that way. They do talk about what's in the risk category. So, and really the risk is what they're looking for as far as complexity. So minimal risk, it gives you examples, low, moderate, and high risk. So as we'll see with high risk, 1 or more chronic illnesses with severe prescription side effects or worsening, potentially life-threatening problems, i.e. an acute MI, progressive severe RA, potential threat of suicide, abrupt neurological changes, i.e. a seizure, a TIA, or weakness or sensory loss. So you can see they're thinking on the hospital level of things, that's high complexity, that's high risk. We don't always see these things in our office. Sometimes we do, though. We've called the 911 more than once in our office. Luckily, not very often, but it does happen. So those things are seen in the primary care office at times. So those are a couple of tools for you that I'm pulling from as we go through this PowerPoint. So I'm going to go back over here. Here's another way to look at all of this. With your 2 of 3 that are required for an established patient, for a 213, again, I'm focusing on 213s and 214s because that's typically the most common thing that we're seeing in our office, and I don't want you to short yourself. You should probably be getting more 214s than 213s if you're charting well. You have your detailed history, detailed exam, moderate decision making. Time is, we're going to talk about time, but typically that has to be a secondary factor unless you're spending a bunch of time in counseling. But typically the time is 25 minutes face-to-face for a 214. Again, easily done in the naturopathic office. Couple more chart examples. Content versus quantity. This is an entire chart note, and it arrives at a 99214. You do not need to be asking every question under the sun to be able to get this type of billing done. So chief complaint, you're following up on hypertension and hypothyroid. Right off the bat, we have 2 chronic, maybe stable illnesses, but 2 chronic illnesses. HPI, 65-year-old male with hypertension, blood pressure has been controlled, so there's our status, denies headache, shortness of breath, or tinnitus. Hypothyroid is now stable as well. Recent thyroid stimulating hormone testing was normal.